everybody, my name is Maria Belén Cordero, and today I'm going to talk about uncomplicated urinary tract infection. But first, we're going to listen to Dr. Mark Mims, who is going to explain us more about urinary tract infection.
Affecting people of both sexes and all ages, the urinary tract infection doesn't discriminate.
At any one time in the world, 2% of the female population will have a urinary tract infection.
At best, it's an annoyance. At worst, it can cause serious illness. UTIs go by different names depending on what part of the urinary tract is infected. Most commonly, it's the bladder.
Usually it presents with symptoms of urination, frequency, urgency, burning on urination, may even see blood in the urination. You might have a fever, might not have a fever.
More frequent in women because of their anatomy, the infections are caused by any number of bacteria.
The most common is E. coli. About 85% of all urinary tract infections are E. coli. And actually about 85% of an uncomplicated urinary tract infection will respond to sulfa if the person doesn't have an allergy to that, usually responds.
A short course of antibiotics is usually all that's needed to clear the infection, but for some people it isn't that simple.
If there's any problems, such as they're also diabetic, or they have a problem where they've had some previous surgery in that area, you may want to run it a little longer. There's other infections that won't go away over a period of time that you have to run for maybe 3 or 4 weeks. Another subset of people who develop urinary tract infections so frequently, we actually put them on a suppressive, what we call a low-dose antibiotic, something to kill the bacteria, but not necessarily be a heavy antibiotic.
If chronic infections are untreated, it can result in scarring of the bladder or kidney. So while UTIs are a common complaint, it's important to take them seriously. For Lee Memorial Health System, I'm Amy Osher.
So, the term urinary tract infection refers to the invasion of a structurally and functionally normal urinary tract by a non-resident infection organism. And the Escherichia coli is the leading cause of urinary tract infection, and the infection is followed by Staphylococcus prophyticus. Some of the signs and symptoms of urinary tract infection includes dysuria, urinary urgency, urinary frequency, suprapubic discomfort, fever, flank or abdominal pain, fluid urine, and purine. Now let's watch a video about the symptoms that present people with urinary tract infection.
If you've ever had even one urinary tract infection, chances are you will not soon forget it. UTIs are caused by bacteria, usually from the rectal area, that makes its way into the urethra. In women, this is a short tube that feeds the urine down from our bladder into the bowl. When this tube and or bladder encounters the bacteria, infection can result. Cloudy urine, sometimes a little fever, feeling like you have to pee all the time but nothing comes out. Then once you pee, it's a painful burning sensation. If you think you have a UTI, do yourself a favor and see your doctor. She can test your urine and also make sure there's not another illness such as cystitis or even an STD, which by the way can cause similar symptoms. If the test does confirm that you have bacteria in your urine, you will be put on a course of antibiotics for about 5 to 7 days. Make sure that you finish the entire prescription to be sure you clear that infection. So what can you do to help avoid UTI? Drink lots of water. Pee before and after you have sex. Never hold in your urine. So what about cranberry juice? For some people it does help. Just make sure it's sugar-free. Vitamin C chewables can also help because they acidify your urine. I'm Dr. Evelyn Meyer for No More TV. Live smart, be healthy, no more.
Now, the most common urinary tract infection is the cystitis. It occurs on the lower urinary tract, that includes bladder and urethra, and nearly always in women. In most of the cases, the infection is brief and acute, and only the surface of the bladder is infected. Deeper layers of the bladder may be harmed if the infection becomes persistent or chronic, or if the urinary tract is structurally abnormal. Now let's watch a video about cystitis.
Interstitial cystitis is a chronic inflammation in the bladder lining. Many women that have had chronic pelvic pain or have thought that they've had chronic bladder infections over the years end up having what we consider interstitial cystitis. There's the female bladder, and this is the cross-section or the inside of the female bladder. And this is the inside of the bladder. As you can see, the lining is normally nice and smooth, and with interstitial cystitis, the lining gets inflamed, and these little reddened areas allow the substances in the urine to cause irritation and pain. While we are still doing a lot of research and learning about interstitial cystitis, we have come up with some treatment options. There are medications that you can take by mouth that will help to rebuild that lining. Also, there is solutions that can be actually put right into your bladder that help to rebuild that lining and to decrease the pain. While we're still doing research and learning about interstitial cystitis, there are some treatment options that are available. There are medications that you can take by mouth to help rebuild the lining of the bladder. There are medications to help decrease irritation. There's also solutions that your healthcare provider can put directly into your bladder.
Now, pyelonephritis, on the other hand, is an inflammation of the renal parenchyma, calyces, and pelvis. It is commonly caused by bacterial infection that has spread up the urinary tract or has traveled through the bloodstream to the kidneys. Severe cases of pyelonephritis can lead to pyelonephrosis, that is the accumulation of pus around the kidney. It also can cause urosepsis, kidney failure, and even death. Let's watch a video about pyelonephritis.
Hello, my name is Dr. Kurt Bell, and I'm a board-certified emergency physician and the medical director of the urgency room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. Carolyn McLean, a board-certified emergency room physician. Your healthcare provider at the urgency room diagnosed you today with pyelonephritis, which is a kidney infection. This infection usually comes from an untreated bladder infection, or UTI, that occurs when bacteria travel up the ureters, which are the tubes that connect the bladder to the kidneys. Pyelonephritis can be extremely serious and sometimes result in hospitalization. However, your urgency room doctor decided that you're well enough to undergo treatment at home. So please make sure to follow the instructions you were given so you can get better fast. Your doctor prescribed a strong antibiotic to kill bacteria causing your infection. Your doctor likely asked for a urine culture, which is done to show which antibiotics will work best. Results of the urine culture usually take 2 to 3 days. When the culture result is complete, we may have to contact you to put you on a different antibiotic. Please watch for signs of an allergic reaction while you're taking antibiotics. Symptoms include rash, lip swelling, difficulty breathing, wheezing, and dizziness. If you develop any of these problems, stop taking the antibiotic immediately and come see us at the urgency room right away. To manage any pain you may have been having, you can try medications such as acetaminophen, ibuprofen, or naproxen. If your doctor prescribed a narcotic such as codeine, hydrocodone, or oxycodone, please don't drive for 4 hours after taking it. And if the narcotic contains acetaminophen, don't take Tylenol with it. All narcotics will cause constipation, so it's important to eat a high-fiber diet. Your doctor may have prescribed a medication that numbs the bladder to reduce burning pain. This medication will change the color of your urine and tears to blue or orange. If you wear contacts, you shouldn't wear them because they could get stained. Please return to the urgency room as soon as possible if you experience any of the following symptoms. You have severe or worsening back pain, you're vomiting so that you can't take your medicine, or have signs of dehydration, such as urinating less than 3 times per day. You have persistent fever of over 101.5 degrees. You have significant confusion or are very weak, or if you feel very ill. Make an appointment with your regular doctor within 24 to 48 hours after starting the antibiotics to make sure that your symptoms are improving and your infection is clearing. Because kidney infections can be serious, it's important to follow up with your doctor, even if you're feeling better. If you can't get in to see your doctor for any reason, stop by the urgency room for a follow-up visit. You can rely on us for fast, reliable care in our state-of-the-art medical facility. We hope you feel better soon.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.
Applications in medicine. The antibiotics are used to treat urinary tract infection. Most of the cases, the urinary tract infection clears up after a few days of drug treatment. Even though severe cases may require several weeks of treatment. Guidelines recommend using nitrofuration, artemetropine, sulfamethoxazole as first line of antibiotic treatment. The fluoroquinolones such as ciprofloxacin may also are now only recommended after other antibiotics are not appropriated. Finally, the diseases that are related to urinary tract infections include pyonephrosis, urethritis, and kidney failure. Let's watch a video about urethritis.
Hi, I'm Dr. Justin Davis, and today I'll be talking to you about a condition known as urethritis. Urethritis describes when the urethra becomes inflamed. The most common cause is infection, but other things can cause this as well. The urethra is the last part of the urinary system before the urine or other things that travel in the urinary system are excreted. So first you have the kidneys. The kidneys make urine. These then are transported through small tubes known as ureters, which go into the bladder. The bladder then empties into the urethra, which excretes the urine in both men and women. The urethra in men will travel through the penis and is also responsible for excreting certain sexual fluids like semen. And in the woman, the urethra comes out just above the vagina and is really just responsible for getting rid of urine. The symptoms of urethritis typically are pain in the urethra or an urge to go to the bathroom. Sometimes you'll have blood, but it's usually a general discomfort. Sometimes men also will have a discharge that comes out of the urethra. Treatment is really based upon what is causing the problem. So if it's an infection, it's important to know what kind of infection. Probably the most common type of infection, particularly in women, to cause a urethritis would be from just regular old bacteria that cause a urinary tract infection. In men, this can also cause urethritis, but also common, particularly in young men, are diseases like gonorrhea and chlamydia, which can cause a urethritis. In both cases, it's important to identify and treat properly because it can travel up to the kidneys, particularly in women, causing a kidney infection, which can be much more serious. Or in men, it can also travel into some of the other sexual organs like the testicles, causing what's called an orchitis or an epididymitis, which is much more serious and more painful and more difficult to treat. So prevention, while prevention is aimed at early identification, going to a doctor, having the doctor do a test that will tell you if there's an infection or another cause, and if there is an infection, what's the most likely organism causing that, and what kind of medicine to take. And in the case of a sexually transmitted disease, of course, careful sex practices and use of condoms is an excellent way to prevent urethritis. Action, again, is really mostly just letting someone know at the start of these symptoms, as if they're untreated, they can progress into something more serious.
Now let's go to be about kidney failure.
Kidneys are a pair of about 12 centimetre long bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has two kidneys, which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have three important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumour or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the functioning of the rest of the body. If you're suffering from a kidney disease, kidney failure can occur. In that case, your kidneys are not able to filter waste products and fluid adequately from your blood and extract them from the body. When the kidneys don't function properly, you might have the following symptoms: fatigue, nausea and loss of appetite, skin itching, high blood pressure, difficulty in concentrating, difficulty in sleeping or excessive sleep, shortness of breath. If the kidney functions can't be restored and both kidneys fail, then dialysis is needed. It is necessary if the function of the kidneys is less than 10%. The function of your kidneys will be performed artificially. There are two major types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, your blood is filtered through a dialysis machine outside your body. In peritoneal dialysis, a dialytic fluid is flushed through your abdominal cavity, extracting the waste products from your blood. An alternative for dialysis is kidney transplantation. You get a healthy kidney from someone. Your general practitioner can give you more information about the disorder and its possible treatments.
Now view nephrosis.
This is the pyelonephrosis of the kidney. Here in these lobules the pus was filled there, and we had drained the pus and we had done nephrectomy of this patient. Can you see this kidney? ऊपर दबो काटता दो उसको, नहीं काटो इससे ही करो। हाँ
Okay, that was a very short video. And
this is the
thank you for watching.
process of the kidney. Here in these lobules the pus was filled there, and we had drained the pus and we had done nephrectomy of this patient.